Hi, folks. Chris Voss here from the ChrisVossShow.com, the ChrisVossShow.com. Hey, we're going to your podcast. We certainly appreciate you guys tuning in. Thanks for being here. Go to youtube.com/Chris Voss to see all the things we're doing over there. Also, go to goodreads.com/Chris Voss. All of our groups on LinkedIn, Facebook, Twitter, Instagram, TikTok. Geez, there's like a new one every week. We try and keep up as best we can. Go over there, follow the Chris Voss Show, and of course, my stuff, Chris Voss, as well. Today we have an amazing guest on the show. He's going to be bringing a whole mess of insight into the world of plastic surgery. He's a plastic surgeon who prioritizes patient relationships. His name is Dr. John Mesa. He's been a plastic surgeon specializing in cosmetic surgery for the past 11 years. He's a native of Colombia, and he was first interested in studying architecture because he was very intrigued in symmetry shapes. But then eventually realized that being a plastic surgeon is like being an architect, which it kind of is when you've seen some people that have had it. So he pursued his ambitions passionately. Welcome to the show, Dr. Mesa. How are you?
Thank you so much, Chris. I'm doing really well. This is an honor and a privilege to be here in your show.
And it's a privilege to have you on our show as well. Give us your .coms where people can find you on the interwebs and get to know you better.
Yeah, it's very simple. It's my last name, drmesa.com.
Man. Wow, that's awesome.
Either DR or doctor spelled out mesa.com.
Oh, you got both. Wow. God, yeah. Maybe I should be a doctor. That's great. You got that really quick URL. So tell us more about who you are and what you guys do.
Okay, I am a board-certified plastic surgeon. I am, as you say, I'm originally from Colombia, but I did my surgical training here in the United States, and now I practice cosmetic plastic surgery. I have 3 offices, 2 main offices. The one is in Manhattan, New York. The second one is in Livingston, New Jersey, and I have a 3rd satellite office in Miami. And I specialize in cosmetic plastic surgery, and my passion is do any cosmetic plastic surgery of the face and the neck.
Wow. So my first question to you is, how much is it going to cost to make this face look like Kim Kardashian right here? This face right here.
No, if you want need a couple of pennies and that's it. You don't need too much.
Sure, yeah, $9.95 or something. Yeah, sure. Anyway, so what sort of training went into your plastic surgery? Where did you go to school, your residency? And we kind of got a little tease from the bio on how you end up choosing plastic surgery, but tell us more.
Okay, my training is a little bit extensive. So I did medical school back in Colombia, South America. Over there, medical school is combined with college, so it's a 7-year program. Then I came to the United States and I did a research fellowship at Harvard. That fellowship was for 5 years. Then I started to do my general surgery training also at Harvard at the Brigham and Women's Hospital. Then I switched to do plastic surgery training at University of Penn State. Then I did a fellowship in craniofacial surgery at the University of Michigan, where I published a book about operative techniques for surgeons. And then I did a 3rd fellowship in cosmetic plastic surgery. This one is specializing in face and neck, and that was done at University of Alabama. When you add all that together, it's almost 18 years of training.
18 years of training, man. That's a lot of training. And what kind of clientele does your company serve?
I mean, I serve anybody that is interested in natural-looking cosmetic plastic surgery, especially with the face and the neck.
What about those people that are like, you see him on that show Botched, or you see him, they want like, they really want to go out there. Like there's the lion lady, and then I think there's a couple people that want to look like Barbie. What about those folks?
No, I don't accept those folks, because for me, the reason for doing cosmetic surgery is to have a better version of yourself. When you do those extreme changes, I don't think those are really aesthetically pleasant, and I don't like to do those ones. So that's why even they can pay me millions, I won't do them.
So you're not going to do my Kim Kardashian surgery then, probably, huh?
Maybe.
So this is kind of interesting to me. Evidently, you do most of your procedures under local anesthesia versus general.
Correct.
Ouch. Tell us more about that, and why you think it's a great thing for your patients.
Yeah, the reason why I like to do my procedures on the local anesthesia is because I don't have the ouch.
Oh.
People goes to sleep. And traditionally, people get surgery under general anesthesia because it's a painful procedure and they feel the ouch. But with the technique that I developed when I was doing my fellowship training in University of Alabama, I came up with a technique that makes the local anesthesia procedures painless. People don't feel any pain from the beginning to the end. And the advantage of that is, one, you avoid all the risks of going to sleep or general anesthesia or IV sedation. And secondly, the recovery is faster. You don't have to stay in the hospital or go to rehab. You just stand up, dress, and then you go back home like nothing happens.
Wow. That's awesome, man. That's awesome. I mean, hey, do you want to tell us the secret sauce, or is that a proprietary secret sauce?
I mean, no, the secret sauce is like you need to like to talk to the patients, because most surgeons don't like to talk to the patient. They like to put the sleep and then work fast. I like to talk to the patients, and when I'm kind of talking to them, I kind of distracting them when I'm doing the numbing. And once the numbing medication is injected, the area is really numb and they don't feel anything else, and that's when I do the procedure.
Okay, so they're still getting a little bit of numbing, so they're not fully. Yeah. Okay.
No, they are completely awake, but the area, for example, if I'm going to do a neck, all the neck is completely sleeping, but only the skin and the neck. But you are completely awake.
Nice. Now, you have a specialty, and I'm not sure how to pronounce this correctly. buccal fat. What's the proper pronunciation of that?
Some people say, I say buccal fat removal. Some people call it buccal fat removal. Either one.
Okay. So what is that?
So buccal fat removal is what I consider the most best kept secret in Hollywood. Because you see, when you see people, celebrities, actors, and actresses, they look very chiseled. Nobody's chubby. Everybody looks like a supermodel, and most of the time is because they have undergone this procedure. That is removal of a specific pocket of fat in the lower anterior cheeks that is called the buccal fat pad. And then when you remove that, you make anybody that has a chubby face to have a V chisel face like the celebrities. So that's my number one surgery nowadays.
I'm not sure if you're familiar with her, but Ozzy Osbourne's daughter, I forget her name.
Yes.
But she had kind of a fatty face like mine, so I don't feel too bad. But I think she's an awesome gal. I'm not being mean, but I mean, there's if you look at her, she kind of got her dad's genes, unfortunately. Sharon's a beautiful woman. So recently she showed up with really chiseled facial looks. This after her, losing a bunch of weight and stuff. Is that possibly the procedure that she used?
I mean, I am not her plastic surgeon, but on my experience, I would say that yes, she did have buccal fat removal, because even though you lose weight, you cannot go from a chubby, kind of round shaped face to a very chiseled look. That is always buccal fat removal.
So I'm losing a lot of weight right now. I think I'm up to about 60 pounds, and I've got to lose a lot more. But I'm doing pretty good in intermittent fasting. But I'm probably still gonna have a fat face then, huh? Probably gonna have to have some of that removal done.
Yeah, most of the time, yes. Because what happens with those pockets of fats is that when they grow, they are very difficult to shrink them. So people, I would say maybe 5 or 10% of the population can shrink them with diet and exercise. But the majority, 95% of the people, they will need surgery if they want to look like they.
Note to self, call Dr. Mesa when you lose all your weight, you fat face, Chris Voss. Anyway, just had to make a note there. But I probably will. I mean, I've seen that where you'll see somebody and they kind of got like a little chubby-ish face. They lose a bunch of weight, and then all of a sudden they're chiseled, and you're just like, hey, what's going on there? And but I mean, you're cutting on the face. You're doing something with the face. So who knows? I'm just gonna pay someone to slap me real hard, and they'll slap all the fat out. That might work. I don't know. That or
it's a good idea.
Yeah. Well, so, well, this is kind of interesting. So you specialize in that, and mostly the face and neck. You say for that fat that you work on a lot.
Correct.
There you go. So next time someone calls me a fat face, I don't know. There's some sort of joke there, but I can't find it. So what should people know when they're choosing a plastic surgeon? What should they look for? What they should be aware of? We heard a lot of crazy stories out of Florida of concretes being put in butts. And everybody knows concrete gets put in the belly, not in the butt. But and all sorts of weird plastic surgery things. So it's important to pick a good surgeon. What should people know to pick the right one?
Okay, the most important is that you need to make sure that the plastic surgeon is board certified by the American Board of Plastic Surgeons, because that's like the baseline warranty that tells any patient that the plastic surgeon has undergone the minimal training to do the best result that you can have with minimal risks. So, because as you said, there is a lot of plastic surgeons wannabe that they think that they are plastic surgeons, but when you go to check, they don't have board certification, and sometimes they don't have even the plastic surgery training. So that's very, very important. And the second thing is that you need to find a surgeon that specializes in the procedures that you are looking for, because it's like the book, the outliers, like with the $10,000 hours of training of experience. The more you do a procedure, the better the outcome, the less the risk. So, for example, if you want to get the chin liposuction, you should go to somebody that does a lot of chin liposuction, not to the ones that does one or two in a while. And also, very, very important, what I tell the patients is that you need to have good rapport with the doctor. Why? Because even the best plastic surgeons in the world, they may have some complications. Not always everything goes well. Why? Because this is medicine, and plastic surgery is not an exact science. It's like it's an art, and sometimes even though you do everything, patient's conditions or anything, something can go wrong. And if you don't have good rapport with the patient, then if something happens, then what is the natural occurrence? You're gonna try to go to somebody else's, and even if you go to another doctor, he or she is not going to know exactly what is going on with you. So I have had complications, and I take care of my patients, and they will work together to make sure that everything resolves at the end of the day. And I think that's very, very important, because when you try a plastic surgery, you need to try like a marriage. It's something that is like a long term, not like a quick date. And if you don't like it, bye after the procedure. You need to stick with that in the good times and in the bad times.
This is kind of interesting. Matthew was just chiming in on a comment here. He says, so an important part of your practice is true consultation with the clients. Thank you, Matthew, for that input. He was also helping me out with the Kelly Osbourne name that we were trying to reference earlier. So thanks for helping out there, Matthew. We appreciate you watching and being a part of the show. So let's see. What are your most popular procedures that you're doing now, and what has COVID impacted you and your business?
I mean, my top 5 procedures are the number one is the buccal fat removal, the chubby cheek reduction surgery. The second one is chin liposuction. The third one is a tightening of the face and neck with minimal invasive device. And the fourth and the fifth are the facelifts and neck lifts under local anesthesia.
Is there a certain age where you won't do them anymore? That I'm asking for a friend.
No, I do it in all the ages. I mean, even in minors, they have to come with the parents and give permission. And I do surgery in people in the 70s, 80s. No matter if you are in good health and you can get the surgery done, and you are a candidate and you will benefit from that, I can do it.
There you go. Well, my friend is 53. Note to self, call Dr. Mesa when you get done losing weight. Sorry, I just had to make a note there. So this is pretty interesting. COVID, I guess, just, everybody's still going on with COVID. And on your clients, are your clients a variety of ages, male or female largely, that you're seeing these days, or how does that work?
I mean, usually in plastic surgery, the majority, I would say 90% of the clients are female, but I also specialize in male plastic surgery. So I would say my ratio has shifted. It's about like a 70% women, 40% men.
Wow.
So I've seen a big population of men. And regarding on the previous question that I didn't answer about how COVID affected plastic surgery, I would say that in my experience, when we were in the lockdown, there was zero cosmetic plastic surgery because any elective surgery was asked to be stopped. But then afterwards, it has been a boom because of the fact that now during COVID, people has to work from home. They don't have to be present in the office. So you can, most of the time, patients come They take 1 day off, they get the
Whoa.
surgery done, they go back home because it's local anesthesia, they don't need to be in the hospital, they go back home, and the next day they start working from home, recovering, and if they have to do a web call like today, they don't turn on the camera, and that's it. So
that's the way to do it. I turn on the camera and scare everybody, like, ah! That's what I do.
So that's why right now people has more advantage and more time off to undergo elective cosmetic plastic surgery.
There you go. And Matthew, he's Mr. Questions today. What is the most popular procedure for men and also for women? Thank you, Matthew.
In my practice, for men is the buccal fat removal, the chubby cheek reduction. And in women is the combination of chin liposuction and buccal fat removal.
I might know some people that have some of that going on that are probably going to do that procedure these days. So what new plastic surgery procedures are the newest and latest things? What's the hottest thing on the market these days?
I mean, the hottest thing right now is like the minimally invasive procedures to tighten the skin. There is a device called face tight and neck tight that uses a very small incision, and a catheter is kind of placed underneath the skin, and then it releases radio frequency that is a kind of laser energy, but it's not a laser, and it kind of heats up the skin and the deep tissues, and it produces a skin shrinkage. So basically, you're getting a mini facelift or a mini neck lift, usually on the local anesthesia with no big scars. So, and the recovery is faster, so the people is loving it because they can be a better version of themselves without undergoing major cosmetic surgery.
That's pretty freaking awesome. I mean, wow, the stuff they can do nowadays, it's like crazy. Which explains all those Hollywood people, like I said, like Kelly Osbourne, that you see. You're just like, all of a sudden, like I just saw her, like her face was just cut, and I was just like, what happened? So yeah, I need to be up to that sort of stuff. What procedures won't you perform?
What procedures I won't perform, like the ones that you mentioned before, anything that is grotesque, that is out of that is not like a routine. Things that are exaggerated. For example, if somebody comes for a breast augmentation and they want a triple D, like a 1,000 cc implants, I won't do that. Or anything that the patient don't need. Sometimes patients comes to me and say, oh, I want to do fillers, or I want to do lip fillers, for example, and the lips are already big. I would say I won't do it because I want you to look natural. If you want to look overdone, I don't want my last name attached to those lips.
Yeah, and as a guy who's single and on Instagram a lot, I mean, you could hire me if you want me to talk to those people and say, hey, look, that catfish, the big floppy flippity lips, some of those girls, it's a turnoff. I'm like, you ruined something that was really nice, and now it's like you're just like, I don't know. That's a horrible way to try and visualize it, I suppose. But yeah, I mean, I really wish women would just be a little more careful. I mean, I don't know, man. I'm trying to figure out who actually likes that sort of stuff.
Yeah.
So anything else about your practice and how to be success and advice for people that need plastic surgery?
I mean, advice that people, first of all, they should be ashamed of undergoing plastic surgery. I tell a lot of people things that cosmetic plastic surgery is vanity, that you shouldn't do it, that it's like a moral issue. And I explain to my patients or potential patients that cosmetic plastic surgery is like getting a haircut. Why do you get a haircut? It's because you want to look good and you want to be presentable and you want to look good to others. So cosmetic plastic surgery is exactly the same. If there is something that you don't like about yourself, especially in the face and the neck, and you want to be improved, then do like a haircut. Then you get it fixed, and then that is going to help tremendously the self-esteem, because a lot of people is shy, they don't feel confident because they don't look the same, especially when you're aging. Because when you age, usually the face ages really fast compared with your mental age. So you need to do like a sync in those areas. And that's kind of the most important things. And also to understand that now it is possible to undergo most of the cosmetic procedures on the face and the neck, on the local anesthesia, with no pain, with no ouch.
Ouch. No ouch. That's the most important part. I like the no ouch part. Matthew has another great question for you. He's the king of great questions. Are any of your procedures covered under insurance plans? I'm sure he's asking for a friend.
No, unfortunately, no, because cosmetic plastic surgery is not medically necessary. And the definition of medically necessary is that if you don't do the procedure, somebody can have a life-threatening condition or can die, and nobody's gonna die because you don't look better yourself. So my all the procedures that I do are strictly cosmetic, and therefore they are not covered by insurance.
There you go. Well, I think I would argue that me being turned into Kim Kardashian is a life-threatening procedure. That or Kim Kardashian is life-threatening. One of the two. Sorry, I've lost the Kim Kardashian crowd, I'm sure, right now. So anything more we haven't covered about you and your practice and what you do?
Yes, that for example, people ask me like, oh, where do you do your surgeries? And I would say if it is general anesthesia, which I'm doing less and less because I specialize more in the local, I always do it in a certified operating room in a hospital or a surgery center to make sure that everything is done with the bells and whistles. And then when I do it on the local anesthesia in either one of my offices, because I do surgery in all those 3 offices, I do it with the highest standards, like if I'm going to put you to sleep, but you are not sleeping. So, because sometimes a patient has shown me, oh, look, I saw the surgeon, and he's doing the procedure, for example, the tightening or something with a pair of gloves. No, I kind of dress up and I do everything like major surgery to make sure that you have the best outcome and with the minimal risk of infection or any complications.
That's awesome. I mean, that's what everyone should do. I mean, if you got something you're doing in, somebody's going to somebody in a back alley, it's probably not going to work out well. That's all I'm saying.
Also for men, men are usually afraid to undergo cosmetic plastic surgery because they are afraid that they are going to look like a woman. And that's true because most of the plastic surgeons do cosmetic surgery or cosmetic procedures, injections.
Yeah.
In women, most of the eye is trained to treat women or men. So I have been there. When I finished surgery, I do Botox myself. But at the beginning, I was doing it with another colleague, and I started to look like a woman with those arch eyebrows.
Oh, really?
Yeah, that was horrible. So when I was in the gym, I was lifting weights. I was like, oh my God, I look like Carrot Top, like with those huge arch eyebrows.
Oh, yeah.
So I didn't like that. So that kind of triggered my passion to really create plastic surgery procedures for men. And right now, that's what people come to me because they look very masculine and they look no feminine with anything that I do. So that's why my ratio of men versus women is changing significantly towards the men.
There you go. Would it be easier to make me look like Gisele Bündchen, or would it be easier for me to look like Kim Kardashian? Which is probably
no. I think because of your skin color, you are closer to Kim Kardashian.
Oh, okay. All right. And I have a big butt, so I mean, it just works right there. So it's been wonderful to have you on, John. Give us your plugs so people can find you on the interwebs and get to know more about you and your practice.
Okay, so very easy. Again, my website is drmesa.com. In Instagram, I have multiple accounts, but the most common one is Dr. spelled out Mesa, M-E-S-A, alone. That one is about a lifestyle, but no surgeries. And the one that has all the surgeries is Dr.Mesa with a number 2 at the end. That's specialized on women. And there is another one that is at Dr.Mesa number 4 and then men. And that is all specialized about cosmetic plastic surgery.
Wow. So I could go on there and find out how to make me look like Kim Kardashian. On your Instagrams, do you share like videos of procedures where people can see things actually going on?
Yeah, exactly. Yeah, and especially in the stories, I show everything that I do here.
Wow.
And that's why most of the patients, they say, oh, when they come and they book surgery with me, they say, I already saw what you do. I know your before and afters. I feel very confident. I just want to meet you and book my surgery. So everything is shown on Instagram and YouTube.
There you go. I think Matthew here has got the URL, drmesa.com. That's pretty freaking awesome. Thanks, Matthew, for your help today. That's been great. So it's been wonderful to have you on. Thank you, John, for spending time with us and enlightening us. Thank you very much.
Okay, thank you so much, Chris. It has been, again, an honor and a privilege to be in your wonderful show.
And to you as well, my friend. To my audience, be sure to check him out. Go to youtube.com/Chris Voss. Hit the bell notification button. Go to goodreads.com/Chris Voss and all of our groups on Facebook, LinkedIn, Twitter, Instagram, all those different places. You can see the Chris Voss Show. We certainly appreciate you guys tuning in. Be good to each other, and we'll see you guys next time.
Bye-bye. Thank you so much.